You're listening to Your Best Life, powered by MercyOne. Join us as we have a fun conversation with certified experts and physicians about health topics for you and your family. It's Your Best Life, our one purpose.
Well, thanks for joining us today. For this episode, we are joined by Dr. David Ensz at MercyOne South Sioux City Family Medicine. How are you doing today, Dr. Ensz?
I'm doing good. Thanks for having me.
Yeah, thanks for being on and talking with us. So today we're going to kind of talk about men's health specifically and some common health mistakes that men should know about. June is National Men's Health Month. So this month we are talking all for the fellas. So just kind of jumping right into men's health. One of the things that is talked a lot about when we're talking about men's health is just the lack of men going and seeing a primary care provider. I believe from the CDC, the stats are women are 33% more likely to visit a doctor than men, and women are 100% better at maintaining screening and preventive care. We're going to just kind of talk about primary care, but can you kind of talk about why having a primary care provider is just important in general for people?
Yeah, sure. It's super important to have, your home base, family medicine, internal medicine, pediatrician office, not only for the preventative stuff that you mentioned, but, also if you're ill, they can be able to maybe get you in a day or two. Otherwise, if you're a new patient, they may say, well, we need to get the records and we can see you in 3 weeks. So it's just good to have that home base for both preventative and acute illnesses.
Right. And our urgent care and our emergency departments are great, but there's something to be said about seeing the same doctor consistently over and over and over again.
Yeah, sure. When I go into a room, I'm not, for the most part, not looking back and back and back in a patient's chart because I've seen them several times and I know them and I know their kids and I know their grandkids, and all the kind of superfluous stuff, but all the stuff that makes up, the whole well-being of a patient.
So one of the reasons noted that men don't want to go to a doctor or don't want to go in for their health is that they just don't feel like their symptoms are bad enough. They don't want to come in until the symptoms are so bad that it's interrupting their day-to-day life. Can you kind of talk about why waiting till that breaking point isn't very helpful when it comes to your health?
Yeah. So, I don't know if it's a testosterone thing or maybe just kind of a chromosome thing, but we do tend to see that as guys. And I don't want to, there are a lot of obviously male patients who are right on top of their health, but we do see women more for preventative care, generally than men, but it is good to keep up on your preventative visits because there's some illnesses, some diseases that if you come in too late or when you have symptoms, it's too late at that point. One of the things specifically we mentioned is colon cancer screening at the age. Now we've actually recommended at the age of 45. It used to be 50. So with a colonoscopy or a Cologuard, which is an at-home test, early colon cancers with a colonoscopy can be removed by the GI doctors, and that's it. And they say, well, we had an early stage cancer, we removed it, see me in 3 years. Whereas if you let that grow to the point where you get symptoms such as bleeding, when you go to the bathroom, well, maybe it's already spread in stage 3 and stage 4, and now you're looking at big surgery, chemotherapy, and even worse.
And for other conditions, like say, I don't know, diabetes or anything that can relate to your heart, when you push that kind of stuff off, that can also have kind of a negative effect, right? Yeah,
and we get fooled too, even being in the medical profession. Not all diseases or conditions present kind of classically. Sometimes a massive heart attack could present as indigestion in some people, or they might get kind of what they would consider acid reflux, where instead that's a heart problem.
kind of tied into it, but I am kind of going to move from the topic. But erectile dysfunction is a common health problem that it affects men. And I know that ED can kind of be a precursor for other health concerns as well, like having a heart condition. Can you just kind of talk about what erectile dysfunction is and,
Sure.
just how it can be a precursor? Yeah.
Yeah, several different causes of erectile dysfunction. The main one would be, lack of blood flow. As we get older, men don't have the blood flow to the vital parts, kind of leading to erectile dysfunction. You mentioned on a precursor to heart problems that the kind of important thing to consider is, the arteries that go to the penis are the same size as the arteries that wrap around the heart. So if you've got plaque in your penile arteries causing erectile dysfunction, there's probably a pretty good chance you're having plaque around those heart arteries.
And I guess kind of tacked on to that, I feel to kind of go with the other, some men don't want to go in, it's not bad enough, so they kind of just like suffer in silence. What do you say to that? Like, how, if somebody says that to you, how would you respond?
Well, we're in the modern day of medicine, so pretty much any condition that exists or that we have a name to, there's a treatment for. And there's several medicines out for erectile dysfunction, but if the thing to remember is, you touched on the heart issue, is things such as high triglycerides, bad cholesterol can lead to erectile issues. Diabetes is the classic one. Especially if I see a younger person and they're having erectile issues. At that point, I'm thinking, okay, this gentleman's 30 years old. He's having these issues. This shouldn't be purely erectile dysfunction. What else is going on here? Is it a diabetes issue? Is his blood pressure through the roof? Is he a gym rat and he's taking a bunch of supplements that is affecting different aspects of his body? So, a lot of times that, erectile dysfunction is one condition that does hit home with men. A lot of times that'll be just purely what I'll see a patient for visit-wise, but it opens up a door of, hey, we need to look into these things further. And then a lot of times we, uncover some issues.
Yeah. Like you said, diabetes being a common one that's related to it. Kind of just jumping right in, talking about men's health and diabetes, diabetes is rampant across the whole country for both men and women. So how does it present differently in men? Does it affect, how does it affect the body in men?
Yeah, sure. We, being a primary care clinic, I would venture almost, at least a third and sometimes even half of my day is seeing patients with diabetes. It's a very prevalent problem. It can present in a kind of myriad of ways. The classic would be patient would come in and say, I've been very thirsty lately. Gentleman may come in and say, I've been going to the bathroom 6 times at night, and normally I can get through the day. Unexplained weight loss, a lot of times is kind of a harbinger of the condition, as your body, in an effort to try to lower the blood sugars, will pee out sugar, and because you're peeing out so much sugar, you're losing weight. So when I have somebody come in and that may be their only sign and say, doc, I'm just losing weight like crazy, but I'm not doing anything, then that's one of the things we want to check into.
Right. Absolutely. Because rapid weight loss like that does not necessarily mean you're being healthy, right?
I mean, it can be a lot of other things, cancer or a thyroid condition, but diabetes is definitely one of the things we look at. Right.
Absolutely. So I'm going to kind of switch gears, Anya, and I kind of want to talk about alcohol. So when I was doing some research, this was coming up a lot. So one of the statistics that really sticks out to me from the CDC is men are almost 2 times more likely to binge drink than women, and binge drinking being having five or more drinks on an occasion. What are the health effects of alcohol and binge drinking on the body?
Yeah. Well, I mean, obviously the short-term acute effects are any of the problems that can arise from being inebriated after binge drinking, terrible decisions, the rate of falls goes up, orthopedic trauma. But long-term effects, if, it's done on a regular basis, we classically think, okay, the liver is what's affected with alcohol, but people can get heart disease with long-term alcohol use. They can actually get a form of congestive heart failure. Sometimes that's reversible with ceasing of alcohol, sometimes not. It can affect the pancreas. It can cause inflammation of the pancreas, called pancreatitis, which can be very debilitating and very chronic, and even after stopping alcohol use. We'll see later on, depending on how much liquor or beer was imbibed in with binge drinking and other drinking disorders, we can see a form of dementia later on in life, where it kind of looks just like Alzheimer's dementia. But the alcohol has, for lack of a better term, kind of pickled the brain over the years. And then when you get to a certain age, you just can't handle that anymore, and you get this dementia picture.
I also found it very interesting in the same study that I was reading, that I got that fact from. They actually called out the Midwest, that people in the Midwest are more likely to binge drink than other places in the US.
Yeah, no, I've seen those articles, and, you can go back to college, like in Men's Health, you look at the top 10 party schools or the top, alcohol consuming schools, and it seems like there's always an Iowa or Nebraska college there somewhere. And, some people will say, well, it's because there's, lack of nothing to do, on a weekend, and then, minus 10, and what else, we're going to do. But that's kind of a poor excuse, but it's pretty, it's prevalent everywhere, but it's, like you had alluded to, we see it a ton here.
Yeah, we do. We see it a lot. And how does mental health, or how does alcohol play into mental health? Because that's another huge factor in men's health.
Yeah. So, short-term solution type thing, but long-term problem. If it can lead to depression, it can worsen existing depression. A lot of times people use it as kind of a Band-Aid to get feeling better for a while, but that's really all it is. And then it can definitely worsen depression.
Right. Yeah. I know that when talking about depression and suicide, men's health is obviously a huge factor in that, because of the statistics surrounding men and depression and suicide. So what are some common things that you see that men face when around mental health that you talk with?
Yeah, a lot of times when a guy will come in, he won't say he's depressed, per se. It may be, other issues, or sometimes they'll kind of take the role of, okay, you're the doc, you kind of find it, on me. Sometimes depression in men and women can be subtle enough as just people don't feel right, and they're maybe waking up early in the morning and not getting back to sleep. That might be, if you've got to go to work at 7, but you're waking up every morning at 3:30, you can't get back to sleep. That can kind of be a subtle sign that depression, anxiety is playing a role.
Yeah. What else? What other kind of signs do you usually see, or that are common?
If somebody doesn't come out and say specifically, "Oh, doc, I've been depressed. Let's work this up. Let's do something about it." Well, you might see something of the nature where they don't want to be in public as much. That might have to do with a little bit of anxiety, but we think the depression and anxiety is pretty closely linked. A lot of times, my male patients will say, "Gosh, I used to love doing whatever, fishing on the weekend with my buddies, and I would just rather be at home, kind of putzing around." So starting to back off of the activities that you found enjoyable in the past, a lot of times is the first sign.
Yeah, 100%. I'm gonna jump again, a little change of topic. I was wondering if we could talk about skin cancer. June, for us here in Iowa, is a great summer month. And when it's not raining for 2 weeks straight, we get beautiful warm sunshine. So I was just kind of wondering, like, some of the stuff I was reading, skin cancer can affect men more than women, but it's just like incredibly prevalent to begin with. One of the most common types of cancer and for everyone. So I was just kind of wondering if we could talk about it.
Yeah, so it's I think from our end we're seeing it a little more prevalent here. The ozone layer is just every day it's not getting any stronger, and I think the awareness of sunscreen is better now than it was 10 years ago, better now than it was 20 and definitely 30 years ago. But whether you're outside doing summer activities or being outside for 4 hours watching your kids play baseball, there's people are tending to get a fair amount of sun exposure, which is obviously a big risk factor for skin cancer.
Right. And I mean, just here in Iowa, we have 2 seasons, right? We have winter and we have construction season. So all those construction workers and our farmers are outside all day.
Yeah. So it's important, especially if you're a farmer and the hair's getting thin on top, and even if it's not, it's good to have a hat on. The big spots that we look for on exam are the things that protrude from face, nose, ears. Those very common spots for cancers to develop. Somebody's a truck driver, a lot of times they'll stick that left arm outside their window, and statistically there's more skin cancers on left arms than right arms, just because of that.
Wow.
So yeah, it's just it's important to do a monthly skin check on yourself, especially during the summer months, and make sure moles that have been present aren't changing in size, and then you don't have any new ones that arise.
Yeah, absolutely. Now, there are always people in this world who are like, I don't need sunscreen. I don't want sunscreen. I burn once and then it turns into a tan and it's fine.
Yeah, having a tan has no protective value. I mean, if you have very fair skin, the common, fair skin and red hair, you are at a higher risk for skin cancer. But no, the old adage of I turn into a crab, red crab the first time out, and then I get a nice crisp on me and I'm good. Basically, all that does is if you do have a skin cancer, it hides it because your skin's nice and dark.
Wow. Yeah. So again, preventive care, very important. So you talked about skin checks. Is that something somebody can come in to their family doctor for?
It is, and we can do a preliminary one if there is a known skin cancer. It's best to have a dermatologist do total body skin checks. For example, if you've been diagnosed with melanoma, your dermatologist is going to do total body skin checks, every 3 to 6 months on you, just because of the how dangerous and deadly that condition can be.
Yeah, and it can be, especially if it goes untreated and unnoticed.
Yeah.
Awesome. Was there anything else that we didn't talk about in relations to men's health that you think is important for us to plug?
I think you hit some good solid points, at least as a starter. Maybe you could have a follow-up and discuss some other things. But no, this is a great little snippet into men's health. Okay,
well, thank you, Dr. Ensz, for joining with us today. I really appreciate getting to talk to you and getting to talk about men's health.
Yeah, anytime. Thanks for the questions.
Send us your feedback at MercyOne.org/podcast. Your Best Life podcast can be found anywhere that podcasts are streamed.